The secret garden came from a patient request to go outside to see his dogs and his loved ones. We didn't have a space suitable to take our intensive care ventilated patients outside that was private and that was bespoke, that had extra elements added to it which would increase our level of safety and reduce our level of risk for our patients. So one of my colleagues identified this space, and we went to see the trust board and asked them if we could have this space to be able to build a garden. The garden opened in December on Christmas Eve, and we had staff come in and fill the planter with soil, and we had Christmas trees, and we had our first Christmas outside. Since then, we've really wanted to adapt the space to make sure the space is suitable for all of our patients. So we've now got a space that's bespoke. It's a space that has power, oxygen, suction, light, air, heating, appropriate ventilation, meaning that we can do and look after all of our patients outside and provide end-of-life care, rehabilitation care, provide care at the whole part of the patient's journey.
As well as being a vital space for our patients, it's just so important for our staff health and well-being to be able to have this outside space where people can come and just get some sunshine, some rain, just away from the confines of the pressures of their day when they're looking after critically unwell patients. It's just an absolute joy to be able to see staff out here in all weathers.
So today we're planting, which is really exciting because this is a long awaited day. It's a day where we've got volunteers, we've got ex-patients, we've got staff coming in on their days off to come and help plant. We've got our facilities and our estates team. So it's a really exciting day to be able to get the plants in the soil and to be able to start nurturing and start watching them get beautiful. And we've got trees, we've got real trees, so it's really exciting.
I'm Mark Lane. I'm a multi-award winning garden designer. I'm also a broadcaster, and I have the great pleasure of designing this wonderful space here at Derriford. There's that whole idea that when you're in an ICU unit, you sort of get this sense of delirium because you don't know whether it's day or night. You long for basically greenery and obviously something that's living. So this is where a garden really comes into its own. We know that the research has shown that gardens and gardening and also green spaces improve both our physical and our mental well-being. So this is how it all came about. We've got this lovely designated spot, but also it had to sort of dictate the type of garden that we were going to have because we're surrounded on all four sides by walls. The light doesn't come in directly to all of the space. So I've gone for a lovely woodland theme, and when we spoke to a lot of the ICU patients, the first thing they said was we wanted to just see greenery. So a lot of the garden is based on greenery, and then we just have these lovely accents of colour just dotted throughout that just ties everything together. To be involved with this project, I think is something really special. I've designed lots and lots of sensory gardens, but personally for myself, after an accident in 2000, I spent a long period in ICU, and I just knew at that time also that I had that great feeling that I just wanted to be outside, I wanted to be surrounded by nature, and I just wanted to feel the sun on my face and the breeze on my cheek. So being able to do that here and create this space for patients, visitors, staff, anyone who can come and use this space, whether it's for personal times, for reflective time, or whether it's for group sessions or one-on-one sessions, it's going to really help individuals. And we know also that just by sitting in a green space, you sort of open up a bit more.
I was working in Africa, West Africa, as a marine engineer, and came under attack by some locals. We were robbed. I was assaulted and received an injury to the neck by a steel bar, and it resulted in a C5 spinal cord injury, which left me paralyzed from the chest down. I was airlifted back to Exeter, then Derriford, and that's when my stay at the ICU began. I arrived in Derriford, I think July the 20th, 2018, and I was there approximately 6 months. When you're in the ICU, you lose track of all time, and the days and the nights, you lose track of it, and you're essentially in a room all the time. So you do long to get out. You wanted to get out, and I met a rehab nurse, Kate Tantam, who arranged for me to be wheeled out in the bed to a little space which she wanted to make into like a nice garden area, and that was a tonic for me, you know. To go outside and feel the fresh air with my dogs there as well, it was uplifting, you know. They let me bring my own dogs. They're on the bed with me, 3 little dogs, which was another tonic, you know.
It was nice to get them outside, because I think it's hard when you're confined to a little room and it's like the same 4 walls with all the medical stuff, and then you get outside and it's like a breather type of thing, innit? But it was hard work getting them down because it wasn't on the same level, so we had to go down lifts and they had to take all the equipment with them, and it took away manpower for the ward because there had to be 2 or 3 nurses with them, and I think that was when Kate said we need to have it on the same level. So hopefully it will help other patients that are up there for a long time. I mean, it was a nice time, but it was nice going outside.
If it was there when I was there, it would have probably aided my, helped my mental state. Just to get outside with fresh air, look at some nice flowers or plants, talk to your family and friends would be a great thing, yeah.